My name's Michael Byrne, and I work at Virginia Urology. I'm a urologist, and I also do a predominant amount of my surgeries over at Retreat Hospital. Kidney stones are deposits in our kidneys, so we take in a considerable amount of fluid and foods, and it's a deposit that's abnormal in our kidneys. They can be harmless and be sitting in our kidneys for years and then decide when they start to move, and that's when we wind up with agonizing pain. Richmond, Virginia just so happens to be in the stone belt. Kidney stones that are in our kidneys just sit there and wait for a moment either to move or to give us sort of a dull ache in our back. So a kidney stone that's in someone's kidney may feel like nothing at all. You wouldn't know that you had it. Not associated with movement like someone that has back problems, but really sort of just a pain over one side or the other. Now, occasionally you'll have a sharp pain that it'll sort of startle you, and it's unbelievable. And then it'll go away. Now, stones that move or fall into the ureter, that's the classic agony. The patients have rate pain 10 out of 10. You can't move. You can't get in a position that makes you feel any better. It's overwhelming. Other symptoms that could show up with kidney stones could be a change in color of your urine. So even though you're not in any pain, you may notice that your urine either turns a tea color or even bright red. You may urinate some blood, and that could be a sign that a stone is on the move. Now, if you're not going to pass your kidney stones, there's a variety of treatments that you can pursue. The first one is to use sound waves, so that's called shock wave lithotripsy. Minimally invasive. You do need to be put to sleep for that procedure. It's a wonderful procedure. Minimally invasive, nothing goes into your body, and they use sound waves to pulverize the stones. To go up one step in invasive is to go and put a scope or a camera inside a patient. So they have to be asleep, but you drive a camera into a patient, drive up to the kidney stone, and then destroy it with a laser. So you turn it into sand, and the urologist watches this happen. Turns it into stone, makes sure all the pieces are small enough. You can either pull out the pieces or let them wash out. Then you'd wind up with a stent, most likely after the procedure, which is a little piece of plastic that goes in your body. Not like a heart stent, which stays in forever. Kidney stents and urologic stents stay in very briefly for the most part. 4 or 5 days, then they're out in the office. So that would be something called ureteroscopy. It has a higher success rate, but now there's a camera that goes inside your body. To go one step further, for people that have larger stones or more complicated stones, what we can do is put a small hole in a patient's back and extract out all the stones all at the same time. Now, that is a step up in complexity. All of a sudden now we've introduced a higher risk of bleeding, but it is a safe procedure. However, that's usually reserved for slightly larger stones. Its stone clearance rate is quoted in the 90 percentile. You would have to spend a night in the hospital for something like that, is typically the way that we do it. At Retreat Hospital, we also leave patients with a stent rather than a tube coming out of their back. So it's sort of a shift in the way that this surgery is done to try and make it less invasive. If someone does have a kidney stone or thinks they have a kidney stone, a nice amenity or a nice service that we have in Richmond is the Stone Hotline. They can give a telephone call to an 804 telephone number here in Richmond. So it's 804-560-STONE, which is our Stone Hotline, which is a wonderful service, and you wind up with a person on the other end. So you can describe your symptoms and hopefully get seen promptly within the next day or so.